Hi, my name is Emily Ahmed. I'm the Peer and Community Research Programme Manager at Newham Public Health. I'm also a PhD researcher at Warwick University, looking at experiences of power and power sharing in the co-production of health research. So this is a recording of the presentation that I gave on the 26th of March 2024 at the London and North Thames Local Authority Public Health Research Network Conference. So this is here in case anybody wasn't able to make it and wanted to catch up. So this is a 5-minute talk which will share a little bit about a co-produced community research project looking at type 2 diabetes that we've been working on with the Newham Public Health team, so that's London Borough of Newham, and in support of the Newham Centre for Health and Care Equity. So Newham has the highest type 2 diabetes rate in London, and we know that this primarily impacts on our Black and our South Asian communities. So we wanted to tackle these health inequalities and to better understand people's experience of diagnosis, referral and support, and to understand what they think would make a difference. So we recruited a team of local community members who have all got first-hand experience of diabetes. So you can see them here in the photos. This is Fidosa, Jitem, Saira and Ruby. Now, amongst them, they speak fluent Somali, Urdu, Gujarati, Punjabi and Hindi, which has been really helpful in helping them to enable kind of conversations and to connect and speak to some of the communities, especially when they're out doing their research. So none of the team had any previous experience of doing research, but they all bring really different skills, their personalities and their interests. The team have been trained in qualitative research skills, and this has been an ongoing process, so really iterative training, where they've been learning a little bit, going out and doing some work, coming back and learning more. That has included interviewing skills, participant observation, focus groups and community reporting. So they've done loads of research, they've attended local events, some diabetes and weight management programs, they've been involved in focus groups and they've been interviewing local residents. So a lot of what we do in public health can be based often on statistical or numerical information, so that quantitative data. And that's great because it shows us trends and themes and problems, but it is really essential that we also hear the stories, the qualitative data, so that we can understand the impact and the experiences and possible solutions. So to engage with the community to find out what will work for them and how we can work with them, we wanted to use peer or community research. So this is a great tool because it really helps us to use people's lived experiences and understandings of a problem to help generate information and research. So our team have collected some really important insights and information, but I suppose my main point here today is that this isn't really just gathering information. It's really important that we don't just view this as a data mining objective, but it's also a really meaningful way to engage with our community and to ensure that we value their voices and their lived experiences, and that we give them opportunities not just only to design and do their own research, which is obviously a key part of this, but also to think about ways that we can support their personal development within that. So how we do this is just as important as what we do. And that means that the skills that they bring or that they want to develop is just as important as the trust that we build with them and our community. And to do this meaningfully means that we really need to value and support the team as individuals, and that has to be based on their own needs and interests. So for me, this is the approach and the ethos that makes it so effective, and it's really why I think the team have stuck with it, why they've gained the skills and confidence, and why we're starting to have a real impact. So a little bit about what the team have done. So they have been designing and delivering their own research into type 2 diabetes. They shared this and the insights that they've been gathering directly with the public health team and other researchers. That has also been a great way for them to get to know the public health team and then to go out and support the public health team in gathering other community insights. So, for example, they help them asking people questions and to speak to people about the 50 Steps Health and Wellbeing Strategy in Newham. They've also been involved in research with Oxford University, and they are co-authoring a paper which is going to be out very soon in the British Medical Journal. And currently we are also working on their own community researchers diabetes report, which we'll be sharing soon, and that is going to share the methods, insights, the learning and some of the ideas that have come out of their research. This week, we found out that we were successful in our application for funding from the GLA and the London Engagement Collaborative Good Ideas Fund. So the community researchers, they designed their own funding application, and what they wanted to do was to be able to create a podcast which will use the learning that they get through their report and through the analysis and through all the data that they've been collecting, but in a way that they can share it that is much more accessible and interactive than the kind of standard written report. And that's something that they feel is really important, so that they can really engage back with the community and with their own communities and with the people that they've been speaking to. They're also creating their diabetes-friendly recipe for co-production, which we'll be sharing again soon, and that's going to be part of their larger co-production cookbook of lots of different recipes for co-production. And we are planning an event in July with Not Another Co-Production Project, which is a national project that they've been involved in. So that's all for now. Please do get in contact if you've got any questions or you'd like to find out more.